The First Nations Health Directors Association was born through the voice of BC First Nations and the representatives from each of the 5 regions in British Columbia, including the North, Interior, Vancouver Island, Vancouver Coastal, and Fraser regions.
Our ancestors are watching the work. They've laid the groundwork for us.
Being kind to one another, being healthy in all areas.
That work that we're doing might not change tomorrow, but might change 10 years down the road or the next generation.
The FNHDA is one of the 4 governance pillars as outlined in the Tripartite First Nations Health Plan. The FNHDA works to promote culturally strong, experienced, and professionally trained First Nations health directors, to provide technical advice on research, policy, program planning, and design, to support the implementation of community health plans, to build a better health system from the ground up. Our First Nations Health Directors Association was created by health directors for health directors.
We are the First Nations Health Directors Association.
In 2001, the BC Provincial Health Officer acknowledged the serious gaps in health outcomes for First Nations people compared to other British Columbians. In 2005, the tripartite partners committed to closing these gaps in quality of life for First Nations people. In 2007, the First Nations Health Council was created to achieve progress on the health plans and agreements and advocate for these changes.
Self-determination is everything to the health of an individual, a family, a community, and a nation, because without it, someone else is controlling your life.
The regional caucuses were created in 2008 as the venue for First Nations community leadership, health directors, and service partners to determine and shape priorities, policies, and improve health services. The First Nations Health Directors Association was formed, an association of health directors and technical health leads in First Nations communities in BC.
FNHDA provides health directors with personal support, a circle of support to share stories and weave support networks, professional support, a forum to find information, build capacity, plan, and source solutions, a voice on the changing delivery of health services to the First Nations of BC.
A typical day for a health director is to expect the unexpected.
When a health director walks into the office, then a client will come to the door. So there goes the work list.
You have to think on your feet. There's no time to panic. You're there as an advocate for the people to your leadership, but you manage to find solutions for any situation.
Health directors work at the ground level, at the community level. They understand what they see each day.
Health directors lead and transform healthcare. They are the ones who are on the ground. They see the people, which is valuable to the creation of our health plans.
My name is Angie Prince. I'm a board member for the Northern Region. Working in the North, we serve people who live in remote areas. We have telehealth where we work and doctors fly in by helicopter or access our communities through a logging road. We wear many hats as a health director and we work as a team. At the end of the day, you feel full, like your heart is full.
We work very closely with our nurses, our mental health team, community health reps, chief and council, so we know what's trending in our communities.
I have people that work with home and community care. I have medical travel clerks. I have mental health and wellness. The biggest challenge is communicating in an appropriate way.
Just maneuvering through the political storms that our communities go through. But once you maneuver through those storms, sunnier days are always ahead.
Health directors are the voice of the communities. We bring community concerns and community issues to the authority and the health councils. So the TAP process, which is the technical advice process, is the process that we use as health directors to support our communities. We are the voice of the communities. I love the challenge.
I live my life in all four aspects: spiritually, physically, emotionally, and intellectually. If that is what we want for our community members, then we have to be the role model.
I like to uphold the ones around me. I think what our people really connect with is with our culture and traditions.
What we try to do in all of our programs is blend cultural with mainstream information.
Our people are hungry for it.
Health directors deal with trauma on a daily basis, and that's as a result of the residential school, the 60 scoop, the day schools, and people are suffering because of that.
A lot of the effects of trauma are things like mental illnesses, addictions, poverty, being disconnected with your family.
So understanding the trauma that our people have experienced really helps us design the proper programs and services that are needed.
Lateral kindness is very important to us as health directors because in dealing with each other and dealing with complex issues, we have to understand that we respect cultural sensitivity and we respect each other's feelings and issues and voice.
From webinars to the annual general meeting every year to the Lateral Kindness Heart to Heart campaign.
The Health Directors Association is really like a family based on lateral kindness.
The shared vision means everything to me because it represents my children, my grandchildren, and the future generations to come.
We want all of our communities to be strong and healthy, to be seen, in a different way.
Our children, our elders, our families, they need you for the work that you do.
Health is the foundation to rebuilding our nations and gaining our independence back.
When it really comes down to it, community building is nation building.
It all starts with health.
This is your association. We're here for you, we're here to support you, and we're there to provide training, we're there to provide support, collaboration, and mentorship.
The association is the greatest resource and support system that you have access to succeed in your role.
It feels like a family, and it fulfills me just to be a part of that.
If you want to make a difference in your community, become a health director. It's better than being a chief.